we are riding on lung cancer to have cancer programs. We're going to be looking at raising awareness on lung cancer and other cancers as well. We're also going to be looking at early detection of lung cancer. When you detect the disease early, it is more likely to be curable, whether it is surgery, chemotherapy, or radiotherapy, such that it improves the outcomes of treatment and we get more survivors who also actually help with raising awareness. You know, survivors are good advocates, and if we have more people surviving the treatment, cancer treatment, we're actually going to get better awareness on cancer in the country. And this also reduces stigma, such that more people are more willing to go and listen to people talking about cancer. Because right now, mentioning the word cancer, people are so scared that sometimes they don't even want to go and listen, or even just to go anywhere near, because they think cancer is equal to death, or cancer is equal to pain.
How bad is the lung cancer burden in particular in Zimbabwe? And at what stages do most patients present?
Yeah, unfortunately, the burden is significant. We are looking at maybe something like 2.4% of the cases. That's the burden. And unfortunately, a lot of the patients are diagnosed with TB initially, such that by the time they come to the oncologist, the disease is already far gone. So this makes it more difficult for patients to be at a curable stage. So most of the patients with lung cancer are presenting with advanced stage disease. And even a lot of our patients in Zimbabwe, they are presenting with advanced stage disease. And this is a disadvantage, because when the disease is advanced, it is more difficult to cure. And even when you're talking in terms of treatments like chemotherapy, when the disease is advanced, we have multiple versions of that disease, such that even if you give chemotherapy to that patient, the chemotherapy is less likely to eradicate the disease, because there are so many versions. Some of them may respond to treatment, the other versions may not respond to treatment. And advanced stage disease is costly to treat. You may now need maybe chemotherapy, radiotherapy, immunotherapy, all these expensive treatments. And at the end of it all, you may not be able to cure the patient. I personally have some patients who had advanced disease, but they were lucky enough to have what you call targetable agents. These are agents that, you actually take the tissue and then you test the tissue to see if they have got some drivers that make the cancer grow fast. And then we can actually target these drivers. One such drug is called elotinib. I actually have a patient who has been taking this medication for 5 years. But unfortunately, it's only a minority who can have access to treatment, because it's expensive. And as a nation, we can't afford that. So we want to get them when the disease is young and naive, such that we can eradicate it. And better still, if we can prevent the disease through looking at all the preventive measures, things like occupational exposure, things like cigarette smoking. I mean, we need to actually look at our situation as the golden leaf nation we are going to Africa. And it's important how we can look at how we can balance between preventing cigarette smoking, reducing exposure to cigarettes, with getting our golden leaf giving us money.